Hi and welcome back to another video of Medic Notes. This video is on epiglottitis. Epiglottitis is inflammation of the epiglottis and surrounding tissues, most commonly caused by H. influenzae type B infections. The inflammation leads to narrowing of the airway and produces a characteristic high-pitched stridor. Whilst it typically affects children between 2 to 7 years, vaccination against H. influenzae in many developed countries has dramatically reduced the incidence of acute epiglottitis. The incidence of the condition is still high in countries where the vaccine is not part of the routine vaccination program, and an elderly population that haven't been vaccinated. Other causes include strep pneumoniae, strep pyogenes, Pseudomonas aeruginosa, or HSV. For its clinical features, patients will initially present with a sore throat, a fever, and dyspnea, characteristically in the absence of a cough. Late signs of the condition if left untreated include drooling, dysphagia, and stridor. The patient will look unwell and is classically seen, in late stages on the disease, sitting in the tripod position, to allow gravity to assist in keeping the airway open. For investigations and management, all cases of epiglottitis need urgent assessment by senior anesthetist or ENT surgeon, in a HDU or ICU setting. The airway should not be examined without such support due to the high risk of airway narrowing. When epiglottitis is suspected, do your best to not upset the child by examinations, as this further increase the risk of airway closure. Nebulized adrenaline and IV dexamethasone should be started in all suspected cases. Blood and throat cultures should be taken, and IV broad-spectrum antibiotics should be given, alongside analgesia and IV fluids. Most cases are a clinical diagnosis, yet once initial management steps are in place, an examination under anesthesia and intubation in theater is required. Fiber optic nasal endoscopy can be attempted in an attempt to visual the airway to confirm the diagnosis. Patients should be kept on IV antibiotics and steroids until the condition starts to improve. Close contacts of the patient who have not been vaccinated should be given appropriate antibiotic prophylaxis. This is an endoscopic view, showing an inflamed epiglottis. That's all for this video. Thank you.